Good afternoon. My name is Crystal Benton and I am presenting this presentation along with Jessica Cashwell, Emily King, and Jana Moody. Today we will be talking about telemedicine services and the obstacles that providers face when they're trying to implement these services, and also some solutions that go along with the barriers. Our objectives for today are to get a better understanding of what telemedicine is, and to understand the importance of telemedicine in today's healthcare environment. We will also, like I said, discuss some barriers that providers face when they're implementing it, and we will also come up with some solutions, on the other hand, to counteract those barriers. We basically want you to get a better understanding of how we as future advanced practice nurses can use telemedicine services to our benefit, and how we can overcome some of the barriers that we may be faced with. And you'll notice my slides look a little bit different from your slides because I changed it a little bit so you could see it a little bit better on the TV. I know it's not perfect, but this is the best I could get it to look on the TV, so it may differ from your slides, but that's the only reason why. All right, so let's talk about what telemedicine is. The World Health definition is posted on your slide. I'll let you read through that. It's a big, long definition, but basically it talks about the delivery of healthcare services distantly from where a patient might live, and how these services can improve healthcare. Telehealth and telemedicine are often interchanged. So when you think about the two terms, think about telehealth as the broad term. It encompasses all of healthcare: the research, the education, the nutrition part, the nursing part, the provider part, all of it. And then telemedicine is more specifically the provider standpoint, diagnosing, treating patients, getting through disease processes, that type of thing. Telemedicine began in the early 1960s when the NASA program was expanding, and they needed a way to remotely treat and provide healthcare services to the astronauts. So this is where telehealth and telemedicine really boomed, was in the 1960s. Today, telemedicine is used for so many things throughout healthcare, so many services and specialties across healthcare. All right, so the telemedicine really improves our healthcare in many ways. We're going to hear from Jana. She's going to talk to us more specifically about that. And as you listen to Jana, you can kind of follow along on our slide here. I'm not going to discuss the slide in detail because she's going to go over most of it with you. And here's Jana.
Good afternoon. My name is Judy, and today I'm going to talk to you about the many benefits of telemedicine. One of my favorite is the fact that it can be utilized anywhere, even in the comfort of your own home, on your couch, in your pajamas. So while I may talk about this, it's extremely important for people that are immobile, like transportation, or the means such as money and support to travel to receive their health care. So telemedicine has several benefits, but it's especially important for people that live in rural areas such as South Georgia, which is where I currently live and plan to practice in the future. So patients are able to receive health care in their own home or meet with specialists in their local office via video conference, which prevents them from having to travel long distances, stay overnight, and find transportation. And I've witnessed this in my own clinical setting during nursing school. We would have patients come to the local health department. One day a week they would video conference with a nurse practitioner for the health department regarding chronic illnesses such as diabetes and hypertension, and receive follow-up care for that. And these people don't have the means to travel outside the county, so otherwise they would not receive any treatment or follow-up without this telehealth. So having to miss work or school, traveling long distance, and money are all barriers that may prevent patients from seeking specialized treatment. Telemedicine allows them to overcome these barriers and receive treatment and health care in their own community. And then also, according to the Northwest Regional Telehealth Resource Center, hospitalized patients whose care is supervised by a specialist via telehealth have the advantage of staying in their home community where family and friends can visit. And studies have shown that recovery is faster when patients are close to home. So otherwise, if future providers, it's important to educate and ourselves as well as our patients to these modern healthcare opportunities that can afford the entire population to receive better care, easier access, and most importantly, better patient outcomes. By offering these patients resources and the means to receive specialized care and follow-up care that they otherwise not have the means to receive, we're overall going to see better patient outcomes and offer more people to receive health care. So thank you for listening today. Now we're going to move on to discuss some other aspects of telemedicine.
All right. Thank you, Jana. We are going to move on and now talk about some of the barriers that providers face when they're trying to implement telemedicine services. So we found a really good resource. LaRouge and Garfield did a study and they highlighted 5 different areas of provider resistance to adoption of telemedicine services. And these are technology, financial, legal, business, and human resources. And we're gonna hear from Emily, and she's gonna go over in a little bit, she's gonna basically provide us with an example of what it's like as a provider to deal with some of these frustrations in everyday practice. So here is Emily.
I'm on already. I don't have time to sit here all day around this program delay. We've already paid thousands of dollars to get the system put in, and patients are supposed to trust me to take care of them, but yet I can't even make the system work. Jack, can you come in here and help me, please? Hey, Jack, and I think, are you still here? It never fails. When I need somebody to help me with this program, I don't have access to the proper resources to help me fix it. I'm no IT whiz, I'm a provider. Finally, we're working. Let's connect with Mr. King and get this appointment started. Hey, Mr. King, how are you doing today?
Emily, to be honest, a little leery of using this technology. I know that this is supposed to be the new thing and all, and it saves me from having to travel 45 minutes to a doctor, but can you really know what you're seeing and hearing over the screen?
Mr. King, I can understand. A lot of our patients are a little hesitant about this technology at first, but they really have ended up liking it. But let's talk a little more about your concerns. What do you mean I'm not going to be reimbursed for this telehealth visit? The patient has insurance. Yes, ma'am. I'm licensed in the state of Georgia. What do you mean? I wasn't aware that my credentialing didn't cross over into other states such as Florida. The patient requested to see me via telehealth due to lack of specialist in her rural area. I'm the closest specialist to her, so I agreed to see her. Yes, ma'am. Well, now that I'm aware I won't be reimbursed for my care, I will opt out to see these patients. I just sure hope they can find someone else willing to accept them since the specialists in their area are very limited.
All right, so that summarizes in a few different, silly clips, the barriers that providers can face when they're trying to implement telemedicine services. We found a study that showed that really only about 15% of providers out of a sample of more than 1,500 were using telemedicine services. And of those, only about 20% said they were using it more than twice. About 25% said they were using it more than 5 or 6 times a year. So that's really not a lot if you think about all of the providers and how little we're actually using these services. And a lot of it is because of the barriers that we will discuss today. So we're going to start talking about the technology barriers. There's a huge barrier between the telemedicine service and actual technology to get that service. So internet, broadband. As of May 2013, only about 15% of the population didn't have access to internet, but if you think about it, that 15% is the percent that we're really trying to reach with telemedicine services. They're underserved, they're the poorer population. Those are the ones that we really need to get access to. Also, HIPAA security is a big deal when you're thinking about technology services, because you want to make sure that when you're using these internet and broadband services that you're also protecting healthcare information for your patients. Next, we will talk about financial barriers. The biggest barrier that we see that providers note is financial reimbursement. So we know that providers do not want to offer services if they're not going to be reimbursed properly. It's not financially viable for them to keep a practice in business. So the insurance reimbursement is very limited for telehealth services, and Jessica is going to talk to us a little bit about that later. About 30% right now of telehealth services do not meet the requirements for Medicare to reimburse, and we know that a lot of insurances will mimic what Medicare reimburses. And the cost of technology is also something to think about when you're implementing these services. There's legal barriers when you talk about licensing. Emily mentioned it in her video. As a practitioner, you can't practice across state lines unless you're licensed in both of those states, and oftentimes when you're doing telehealth services, your patients are going to be across state lines, so this is a barrier. The scope of practice also differs across state lines in line with the licensing. Liability is an issue. There's very vague and inconsistent laws for malpractice and liability with telemedicine services, and these are all governed at a state level, so it's hard to know what each state is doing and to get kind of on the same page with these. There aren't standards across state lines either, and across health systems there really aren't any standards quite yet because it is a newer service. There are business barriers, so when you think about the health system as a whole, you got to think about the strategic view. You've got to get the support of an entire healthcare organization, which is a huge barrier oftentimes. You have to get everybody in the mentality of this new telemedicine project. There aren't any standards of practice regarding telemedicine yet, and it's hard to integrate telemedicine into existing pay models. So when you think about it, patients are paying for services. How does telemedicine fit into that payment model? Next, we will talk about the human resources barriers. When you're thinking about staffing and that sort of thing, there are limited specialists in telemedicine, so this would require hiring of more nurses, more providers that are very, very proficient in telemedicine services. This also presents an increase in the need for IT support. You also want to depend on clinical champions, and those are limited across our nation and across our healthcare system. And you run into some provider resistance, and this is usually because of the perceived inconvenience of the telemedicine services, implementing it, adopting it, learning how to use it, and all of that. All right, so what we really want to talk about today is how do we break those barriers? We're going to be practicing here soon, and we want to know how we can move past these barriers and use them in our practice. And we're going to talk about the 5 areas once again. So first, the business and the legal. You can't use a service unless your business model supports it and it's legal. So I want to start here. Our solutions for this are to standardize the billing and the payment structure for telemedicine services. So this starts all the way up at the top in administration of a hospital, or even in a healthcare system, or even broader than that in the state laws and that type of thing. There really has to be just standardized payment structure, how patients are going to pay for this, etc. There also needs to be standard protocols within the organization that define telemedicine practices. We want to, as individuals and as health systems, promote compact licensing for providers that would allow us to practice across state lines. We also want to consult legal for liability and for HIPAA security of our technology. Next, we will talk about financial solutions, and this brings us to Jessica. She is going to answer Group 2's question that they presented to us earlier on in the semester. It was a very good question, and it prompted a lot of our research, so she will spend a lot of time talking about this question.
Hi everyone, my name is Jessica Cashwell, and I am here to answer the question about telehealth that was posed to us by our classmates. Group 2 asked, what financial reimbursement will providers receive for the adaptation of telemedicine in their practice, and from whom will they be reimbursed? Well, first off, there is no reimbursement for adapting to telehealth, and the reimbursement for services is going to vary for each patient depending on who their insurer is and the service provided, as well as where the service is provided. I'll start by saying that telehealth, like any other business, is driven by profitability, and profitability in healthcare is directly related to reimbursement. Medicare covers approximately 15% at their telehealth reimbursement procedures. Typically, Medicare only reimburses for services if certain conditions or criteria are met. One is that the client or patient has to be a member of a rural or underserved population. The service has to be provided at an approved site, such as a rural health clinic, a nursing home, provider's office, or a rural hospital. The service has to be provided by an approved provider type, and the service can only involve certain types of technology. So pending that all these criteria are met, the provider would bill for the service as they would any other office visit or consult or whatever the service may be. They just add a modifier that indicates that it was a telehealth service. And unfortunately, the reimbursement for telehealth services is not equivalent to that of the same service if it had been provided in an in-person type setting. When we look at private insurers, it's important to understand that the legal policies for each state vary, and this is what guides the reimbursement of private insurance. There's no consistency regarding which services are reimbursable or if the insurance companies are required to reimburse at all. Some states do require private insurance to reimburse for telehealth services, but the amount of the reimbursement varies across the board, so there's just no consistency. The insurance companies have a lot of discretion in determining how much they want to reimburse or whether they want to reimburse at all. So it just leaves a lot in their hands, and of course, if they can get out of it, they will. So while the benefits of patient care are clear regarding telehealth, it's difficult to understand the risks and the costs that are associated with the expansion of the telehealth services. For this reason, it's likely going to be a while before Medicare expands their coverage of telehealth services. Luckily for the patients, many providers recognize the positive impact that telehealth has on patient outcomes, and they've implemented telehealth into their practice even though they're not being reimbursed for it. So hopefully research in the future will help clarify the costs and figure out how to work it all out so that more insurance companies, including Medicare and Medicaid, reimburse providers and promote some positive patient outcomes. Thanks for your time.
All right. So I just want to reiterate one point that Jessica made. It's providers are using this service even though it's not being reimbursed. So if you get on board with those providers and think about the benefits to patients in the long term, you are going to save some money. So think about it this way. If a patient is discharged from the hospital and you do a telemedicine follow-up visit, that's an easy visit. You review their meds, you review their discharge, see how they're doing. That could prevent that patient from being readmitted to the hospital for a stay that's not going to be covered by Medicare, Medicaid, or whatever private insurance is paying. So if you think about it that way, you think about the benefits long term and the savings long term, then more providers are going to be willing to jump on board. So she did a really good job of going over the barriers and how providers are overcoming them as of right now. I have a picture here of the Medicare reimbursement guide, and it just shows the CPT codes that providers need in order to bill for telehealth and telemedicine services. And it's listed in my resource page if you want to go back and look at it. We've got a link to it there. And the financial solutions really are about just kind of changing your mindset, and then once we change our mindset, then the reimbursement will come and the incentives will come, that sort of thing will come. I'm going to combine the technology and the HR solutions just because they kind of go hand in hand. So on the technology side, we need to provide more portals for patients to use telemedicine services, whether it be computers, tablets, cell phones. We need to adapt telemedicine to be able to be used on whatever platform the patients can get access to. And we also need to increase our support on the HR side. We've got to have more providers on board. We have to have more champions who can teach other providers. We have to kind of promote a change from within the organizations that we're trying to adopt it into. Trying to get people excited about telemedicine. And people will start falling in line if we just keep expanding these services. We also have to have increased IT support. As I mentioned earlier, there's a big shortage of IT help, training, that sort of thing all has to take place in order for telehealth services and telemedicine services to run smoothly throughout that transition and adoption process. And then those incentives, again, that can be provided by either insurance or by the health system itself. So this is just a little summary slide talking about, how we're going to implement these changes and how it all starts with kind of a change from within, and you have to, standardize everything, but also promote telemedicine services throughout the organization, throughout all different specialties, and really get providers on board. I'll let you read over the specifics. I know I'm already a little bit over 20 minutes, so I appreciate you listening to our presentation. We hope that you enjoyed it, and we hope that you check out some of our resources that we used. We definitely had some good ones that we found very, very helpful throughout our project. So thank you very much.